Good afternoon, ladies and gentlemen. Welcome to an auspicious occasion for Specialized Exhibitions and Electromining Africa in particular. Hello and welcome to Electromining Africa Connect. It's more than a show. This is a webinar that's being hosted by SAPEMA. And at the outset, I'd like to just thank the SAPEMA team of Delian, Clyde, and Roxanne. Although not live this year due to the COVID-19 pandemic, to maintain the spirit of the show, Electromining Africa will be hosting Electromining Africa Connect 2020. This week, industry players will unite in celebration of Electromining Africa through participation in the live industry webinar series of contacts and exhibitor product showcases. For the last 48 years, Electromining Africa has been on the forefront of delivering the latest products, services, and innovations to a captive and receptive market, bringing together industries from mining, manufacturing, electrical, power, transport, and new for 2020, an automation section. It is the largest show of its kind on the African continent and highly anticipated by all. This makes the cancellation of the 2020 edition as a result of the global COVID-19 pandemic even more disappointing. However, it's with optimism that we look to keep our industries connected this week. And it's my pleasure to welcome an esteemed panel of industry specialists, subject matter experts that are going to talk about our topic today, which is that of understanding respiratory protection. Make the correct choice. Just a little bit of housekeeping before we tackle the webinar this afternoon. Some information for attendees. There is a chat option at the bottom of your screens. This will be enabled so attendees can chat. I see a couple are coming through already. Feel welcome to converse with your colleagues. There will also be a Q&A available for attendees to ask questions. And although time is limited, we will do our best to progress through some of those. And our partners today, Creamer Media, Shannon has undertaken their representative to post links and respond once the webinar has been completed to all the unanswered questions. Our panelists have agreed in advance to assist in answering all the questions that we may not be able to get through in today's session. The webinar will also be recorded and will be available to all attendees on the Electromining Africa and Creamer Media websites. We will also have a little bit of fun and we'll ask our participants to participate. We'll have a poll once our presenters have been through their respective presentations, and we'll ask you for your inputs, and our attendees will then, or our panelists will then comment on that. Ladies and gentlemen, it's weird in a way. It's strange. We're sitting here at the Johannesburg Expo Center at Nasrec. This should have been our first day of the show. As I stated in the preamble, it's 48 years of history, and this is the first occasion that we don't have a live event. The newsletter that's gone out actually will touch on some of our memorable moments, and I was privileged enough to be here in 1996 when the then President Nelson Mandela opened the show, and I'm sure those of us that were involved in those years will recall those sorts of achievements and hosting those sorts of folk at an event that really is a South African brand. So with that, having set the scene, I'd now like to just very briefly give you an intro of our panelists, and let's get to the business end of today's webinar. Jaco Combrink is one of our panelists today. He's the Regional Business Manager, Personal Safety Division, South African region, Europe, Middle East, and Africa at 3M South Africa. Ronnie Naidu, our next panelist, she's also with 3M. She's the Senior Application Engineer, Technical and Regulatory Manager, Personal Safety Division, Middle East and Africa region. We then have Carl Rocher, who's better known as Buffy. I shall refrain from asking him why. That may well come up during the course of his presentation. He's known as Buffy to his industry peers. He's product and business development manager for UVEX Safety Southern Africa region. We have, as I said, esteemed panelists. There's a lot to get through. So let me kick off immediately by introducing our first speaker today, Jaco. Jaco has been in the health and safety industry since 2006, and he has extensive experience in the selection and correct use of personal protective equipment across various industries and applications. Jaco joined 3M in 2012 and is currently Regional Business Manager for 3M Personal Safety, looking after Sub-Saharan Africa. He's also a key opinion leader for 3M Respiratory product devices. Not being a technical man, Jaco, that sounds rather intense and rather specific. So let me just kick off the afternoon session by posing to you the question. Jaco, how has 2020 impacted your career, your company, the services and technology that you're providing? It would be nice to get a sense of your experience, but through addressing this sort of elephant in the room this afternoon, this COVID-19, and talking to today's topic of understanding respiratory protection and having to make the correct choices for us as individuals and as businesses. Over to you, Jaco.
Thank you, Gary. Thank you for your introduction. Also, welcome to everyone online. I think there's quite a number of people from Southern Africa. I see there's even someone from Israel. So we seem to be touching a wider audience than what we used to. How has it touched my career or the company? Gary, this has been an unprecedented pandemic, not the first one that I've been through personally. We've had some coronavirus pandemics before. We've also had Ebola, if people remember that. So being part and parcel of that, respiratory protection has been my forte now for the last 15 years. It's something that I really find interesting and that I have a passion for it. But what COVID-19 has done even with all their negativity, it really has put a spotlight on PPE and our industry, and especially respiratory protection. And I think further to that, it's also touched the hygiene side of it. We often just talk about, in my industry, we just talk about protecting ourselves against those hazards like dust, fumes, etc. But here's something that is unseen, silent, and it can affect anyone and everyone. And I think being in South Africa and also knowing what our prevalence is for TB in this side of the world, we haven't had something that's really affected the entire population like this has. And it's actually been a learning curve for all of us. I think most manufacturers would never have dreamed of having this sort of demand. So it's put a massive strain on supply chain. Also, it's really put us back into a mode where we need to understand that, are we doing this just for the money, or are we doing this for the right thing? Are we really here to protect people? And I've been saying it for almost 15 years now. For me, it's about the people. And providing solutions, making sure that people are protected. And, to our topic as well today, we need to make sure that we make the right selections. Now, COVID-19 goes much further than what we used to. We're all used to being in the industry or industrial side of it, mining, some of the healthcare stuff as well. But this has touched a much wider audience. So we need to start thinking outside of the box as well. Is it really just about being technically correct? Are there other alternatives that we need to look at? And I think that's really posed a number of questions to OEMs. It's also opened the market to, unfortunately, some unscrupulous players as well. So we do see that in the market as well. But I'll leave it there, and then we can carry on and go to the other panelists. Thank you.
Jaco, thank you for those insights, and I'll certainly come back to you and probe a little bit deeper as the afternoon unfolds. Ronnie, I'd like to introduce you as our next speaker. Besides having an audacious smile, Ronnie joined 3M in 2004 and has held various positions in administration, sales and sales management, product management, and marketing management for 16+ careers at 3M. Also, almost a lifer at the company she served. Ronnie is currently the Senior Application Engineer in Personal Safety Division with added technical and regulatory management responsibilities. In her current role, her main objective is supporting customers with the selection and implementation of personal safety solutions that adhere to country regulatory requirements. As a recognized key opinion leader, she often represents training sessions and lectures to end users and key stakeholders. She also represents 3M on several technical committees and regulatory bodies. Ronnie, that's a little bit about your background, but even more importantly for today, perhaps you could give us some insights into how we go about the practical application of applying our minds to some of what really Jaco opened the door to in terms of the conversation. We're going to have, in uncertain times, big choices to make. Based on your experience and your technical knowledge and insight and your travels as somebody that has spent a lot of time training people, upskilling people, how do we focus on this issue of implementation and decision-making in a technical environment? Perhaps you could share some insights in that space.
Yes, happy to do so. So I'd like to address your last question first, in terms of how do we make that decision and what happens during training. So what we find the majority of the time is that people will just call 3M, for instance, and ask for a respirator, be it an FFP2, an FFP3, or something for gases and vapors. But there isn't really a respiratory program that's been put into place at these institutions. So before I even give you a product that relates to what your inquiry is, I would first require from you the additional information as to what are the exposures. And it's not always stuff that you can see. So having a hygiene report, for one, is very important. Secondly, has the person been fit tested? So when we come to making the right choice, it's not just about making the right choice in terms of what respiratory product you use, but are you using the right style of respirator or the right size of respirator? Because that can have a massive impact on whether it's protecting you or not. So I could give you a Rolls-Royce product, but if it doesn't fit your face, shape, or size, it's actually not doing any benefit to you. So when it comes to application, it's not just about putting a product onto a site. It's about understanding what you're being exposed to and what the best protection levels would be for you, and then doing a fit test to make sure that the product I'm giving you is actually suitable for the environment in which you're working. When we look at also understanding respiratory, I'd like to make mention of the hierarchy of controls here. Before you go to any kind of PPE selection, your first mode should be to look at your hierarchy of controls. And that consists of 5 levels. And these levels don't change, and it should be known to everybody on this call. So your first would be elimination, where you try and physically remove the hazard from the area. Your second level of the hierarchy would be substitution, where you try and replace the hazard with something less hazardous. Your third would be your engineering controls. Here you try and isolate people from the work hazard or try and build machinery around that area. If it should be a safety cage to stop cuts and abrasions, for instance. Your fourth level should be your administrative controls. And here we need to change the way people work. If you feel they're working in an unsafe manner, it's your duty to come up with a standard operating procedure that will eliminate that. And then your last resort should be PPE. And so we're saying your respirator selection should be your last resort after you've exhausted all other controls. I'll hand over back to you.
Ronnie, that's some really good insights. you know, I'm not a subject matter expert in terms of PPE at all. I'm obviously in the world of event organizing, but it sounds like logic needs to be applied. You know, we're talking about very technical issues here in terms of what PPE does do and can and can't do, but it's actually understanding the problem before we go about choosing solutions. How do you choose a solution for a situation if we don't understand what our requirements actually are? So thank you for those insights. That then takes me across to our next speaker, Carl Rocha. Carl, better known as Buffy in the industry, has been with UVEX for 8 years and started as a product consultant, then progressed to regional manager and is now responsible as a product manager for UVEX in Southern Africa. His responsibilities are to manage, advise, and recommend products for the Southern African market for UVEX Germany, as well as developing new business opportunities in this region. His mission is that of UVEX is protecting people. He's a passionate UVEX employee who embraces the UVEX values for quality, enthusiasm, and leadership. Experience in the PPE industry in a wide range of categories, but specializing in eyewear, hearing, hand protection, disposable respiratory protection, and disposable protective clothing. He is an active member of the SABS, SAPEMA technical committees on eye, hearing, and respiratory protection, and is a familiar face to many in the PPE industry. Buffy, welcome. The question I'd like to pose to you, also with a tinge of reflection on your own career and development, how has this COVID-19 pandemic impacted you personally in your role at UVEX, and also just touching then on the Southern African market, which is of interest to a lot of our listeners and attendees today. Perhaps you can give us some insights in that space. Thanks, Cole.
Thank you, Gary. Thank you for the opportunity to provide industry and people with the information, because what I've learned is that you are never too old to learn. And on a daily basis, we have been learning. And platforms like this are very encouraging to make people aware and put the information out there. We are in uncharted waters, and this pandemic has affected us all in many different ways. And Yaku and Ronnie couldn't have said it better in their intros. For me personally, it's about getting the correct information across, making people aware, answering questions. We are inundated with questions on how to, or what kind of solutions, or how can we help people? And as safety specialists, it's in the industrial applications, it's been quite easy for us because we understand industrial applications, we understand the risks of dusks and fumes. But now with COVID-19, this is uncharted. And if I can just make something, just make a comment here, when we look at disposable dust masks, for instance, yes, they protect against dust and having some of them features that will aid and protect against COVID. So, Ronnie, Yaku, myself, we really enjoy these kind of sessions where we can put across to industry and to the public at large what are the risks, what to look for, and what questions to ask. So from my side, I hope and I trust that this next few minutes we'll be able to answer a lot of the questions and put people's minds at ease and assist them. So once again, thank you for this opportunity.
Folks, that's great. Thanks for those respective just sort of insights into your businesses and your take on the COVID-19 situation. We're going to move to a poll, but before we do that, one thought that struck me in all three presentations or reflections is this issue of hygiene. And perhaps I can put it back to each of you just to pass a comment on that and how you believe that, you know, the solutions that we're offering in terms of respiratory products and PPE protection, how this issue of hygiene can affect us. Because I think as lay people, that it doesn't matter whether we're in a personal capacity, whether we're in a work capacity, whether it's production, or whether it's a typical white collar type office environment. This re-emphasis of hygiene seems to be a massive issue. Perhaps I could push that back to each of the panelists just for a sort of top line comment on that, because it will take us then, I believe, nicely into the technical aspects of the rest of the conversation that we're going to unpack this afternoon. But I find it interesting that we're in 2020, and if you know, you read a bit about the last global pandemic that really ravaged the world almost 100 years ago, the Spanish flu. You know, and what came out of that? This issue of hygienism is a substantive one. Can I start with you, Ronnie? Perhaps you could just share some of your views in that space.
Sorry, I was trying to unmute myself. Okay, to tackle the hygiene question. So as both previous speakers mentioned, we've primarily concentrated on mining and heavy industry when it came to respiratory protection. When we looked at hygiene in healthcare sector, it was a completely different product being used. So your hospitals or medical facilities were more prone to using medical masks or procedure masks and not respiratory products. And there's a vast difference between a mask and a respirator. So a mask is basically the flash filament material that loops over your face, that loops behind your ears, or you would tie it behind your head. And that is a loose fitting protection device. So it actually does not protect you from airborne contamination as such. What that does is actually stops you from contaminating your environment. So in other words, if I was wearing a mask, if I coughed or sneezed, it would hold that liquid droplet within the respirator. However, anything that I expel as airborne will go out into the atmosphere and could create an issue for somebody who inhales that. The respirator, on the other hand, provides a tight seal around your nose and your mouth, which we refer to as your breathing zones. So with a respirator, you are not just protecting the environment, you are actually protecting yourself as well as your environment and people in that environment, because all exchange of gas takes place through the filter media of the respirator. So when we talk about the hygiene aspect with respiratory, it becomes an issue when we try and convert people to using respirators rather than masks, because they find it a lot easier to breathe with a mask, because obviously it's not sealing, so air intake and exhalation happens with ease. When they move to a respirator, it takes a little bit more getting used to wearing it on your face and getting used to the idea of exchange of air taking a little more effort as opposed to a mask. And so with the respirators, when we talk hygiene, it can also be split into two different categories. Are we talking about personal hygiene of the person using the respirator? In other words, that will encompass how they don and doff the respirator. That means taking off and putting on of the respirator. And then it will also relate to the environmental hygiene when using respirators. So what are your disposal methods or decontamination methods when using respirators? So just saying it's hygiene could be a very far-reaching subject. It just depends on how you want to address it.
Excellent. Thanks for yeah, Jaco?
Yeah, thank you, Gary. You know, I obviously along the lines that Ronnie said as well, and I need to highlight that we are not hygiene experts. There are hygienists and people that are expertise in that field. At 3M, what we encourage people to do is follow the guidelines of the World Health Organization, because they do a lot of testing. So they take various manufacturers and products and they test it. As 3M, we only manufacture the products. We get that tested according to the standards. In South Africa, that standard would be SANS 50149 that specifically talks about disposable respirators, or in this case, filtering face pieces. So when we talk about hygiene and filtering face pieces, we also follow European standards, which is the EN 149. And what we talk about there is a product becomes a single-use item, meaning it's normally a single shift item. And the reason for that is not always the case that the filtration will be inefficient after 8 or 12 hours. It's got to do with hygiene as well. Because as we work, we perspire, especially in environments like mining. There's a lot of dust, a lot of dirt that could actually obviously get into that face piece and end up in the lungs. When we talk about pathogens and viruses like COVID-19, it becomes even more important, because it's not dust that you can see on your hands, you can wash it and it's gone. So that consistent hygiene, just do what your mother told you when you were a child, wash your hands, don't pick your nose. These things are very relevant. You know, we joke about it, but with us having to wear masks now and globally, people are not used to it. People are going to end up touching their faces more, especially in that breathing zone. So all we can say is World Health Organization is really strong on personal hygiene. Wash your hands, try not to touch your face. And, you know, just apply that. Social distancing is obviously the other thing that is also recommended.
Excellent. Thanks, Jaco. Buffy, just reverting to you, looking at you know, your eye protection and some of your hearing categories. How can you sort of just expand on what Jaco and Ronnie have had to say? I mean, surely hygiene is an important aspect of your products and their application as well.
Well, just to elaborate and to add on to what Jaco has just said, I think, you know, from a lot more practical perspective, the benefit that we've seen of wearing masks is that people are not touching their faces as much. They're not touching their mouths or their noses. So there's not any direct contact to any of these, you know, respiratory where we inhale. So the mask, from a hygiene perspective, before it filters out any dusts or particles, limits that contact, that physical contact. And as the World Health Organization stipulated, you know, physical contact, not touching your face is one of the guidelines. Don't do that, you know. And as Jaco was saying, keep your hands clean, limit contact, and then obviously use the right respiratory device that's available to you. I don't think I can allude much more to that unless...
Just, yeah, a specific question, just linking to that and bearing in mind UVX's product range. Things like eyewear and protective eyewear, they're obvious applications in an industrial environment where you've got flying sparks and chips, wood chips or metal chips flying around. Are you finding a trend where people are saying, well, you know, that is another aspect, because you know, the specialists tell us that if you get the virus on your hand and then you transmit to, like, touching your face and your eyes, for example, that is how you get the virus into your system in layman's speak. Are you finding those sorts of trends starting to emerge?
Yes, most definitely, 100%, Gary. So eyewear is critical. You know, make sure that, one, you try and seal as much of the face off as possible, you know, to eliminate any kind of dust or particle or potentially the virus entering into the eye. There is a certain percentage, and I'm not quite sure on the percentage of risk through the eyes, but we do know that COVID-19 is carried also through the eyes. So eye protection is critical. And again, to limit physical contact.
Excellent, thanks. Folks, what we'd like to do now is let's involve some of our viewers and listeners, and we'd like to post the poll. So if I can ask Shannon just to share the poll with us, and we'll give our viewers a 2 or 3 minute window. There we go, it's up there, it should be on your screens. If you wouldn't mind reading through those 3 questions and just participating with us, answer them and send them through to us. And once we've done that, we will ask the panelists to comment.
Gary, while we wait for that, I see there's a question from Tabu on screen that I'd like to answer. So the question is, what's the fundamental difference between the respirators and face masks that we're currently having in South Africa, especially with regards to COVID-19? All right, so very simply, and I don't want to go into too much technical detail here. If we look at a respirator, if we talk about disposable respirators, this particular topic, it is a tight-fitting face piece that sits over the breathing zone, and that is, well, let's say it's a product without an exhalation valve. The fundamental difference is a respirator will protect the user as well as the environment around the user, whereas a face mask, typically your cloth mask or even your surgical mask, that is just there to protect the environment. So particles will still come in because there's not a tight seal on a mask. So when you talk about mask, it really is there for us as the people using it to protect the environment around us. If there's, for instance, heavy dust and things like that, a mask won't necessarily protect you against all those particles. And I hope I answered that question.
Jaco, just a practical question from a man in the street perspective. As individuals, it wouldn't be practical, would it, to use a respirator, for example, in an office type environment? Would it? Can you?
So Gary, again, the World Health Organization, and I will always talk about that. Their recommendations are that we need to try and protect our frontline workers, people that are going to be exposed to this virus on a daily basis, in fact, on an hourly basis. So for the man in the street, the recommendation is to wear a cloth mask or just a surgical mask, so as to free up some of the stocks that we can then give to the healthcare workers, because those are the people that need to be protected themselves, but also they need to protect their patients from their exhaled breath. So again, follow the recommendations of the World Health Organization, keep your distance, and apply the personal hygiene.
Thanks for that. Folks, our results are through. Perhaps we could share that with all participants. There we go. What I'd like to do is just, as we go through the responses, quite interesting, to the three questions. Perhaps, Ronnie, you could, let's turn this around. Do you inspect your respirator before each use? 71% of respondents have said yes. What are the implications? Let's look at it the other way. What are the implications if we don't do that? What are some of the dangers? What are some of the pitfalls around not doing that?
Okay, well, I'm very glad to see that we're at least above the 50% mark with that poll. But if you do not inspect your respirator prior to use, you could be using a product that's defective. And if it's defective, then it's defeating the purpose of why you're wearing it. For instance, I'm going to just grab one out of the box. All respirators come with two straps. If one strap is missing, you already have a problem in that you are going to have a loose filter media on your face. Then it's not going to be creating that seal that Jaco mentioned, and you're obviously not going to be protected. If you look on the outside, you have a metal nose clip. If this nose clip is damaged, bent, or broken, again, it's not going to take the form of your nose bridge, creating an inlet on that section. If there's any damage to the seal itself, and by that I mean the outer seal, if there's any damage there, if there's a kink or a fold in that, that is an inlet for the air to enter or escape. So again, you're not going to get filtered air coming through there, but rather contaminated air. So it is very important to make sure that before you put the respirator on, you do inspect it for any kinds of damage. And if you do see any kind of delamination or damage, you should discard that and take a new respirator.
Thanks for those insights. So often these things seem obvious, but not always in the application thereof in the field. Do you want to comment quickly on the response to the second question? Do you perform a user seal check before each use? I think you touched on some of that in your first answer.
All right, so the user seal check is just a way to make sure that once you've seated the respirator on your face, that it actually is creating a seal. So again, I'm going to repeat, if it is not giving you a complete seal around your breathing zone, that is a way in for contaminated air. So a user seal check should be done every single time you put the respirator on. The problem is we are creatures of habit. And what tends to happen is that over time, we've become very relaxed about how we actually fit the respirator on. And you could miss 1 or 2 steps in the actual donning process. And those steps could actually lead to you becoming contaminated by your environment. So just by doing the user seal check on a daily basis, every time you put the respirator on, you are making sure that the seal you've got on your respirator is 100%. That way you know you are protected.
Okay, folks, can we go to the next question? Yaku, I'm going to ask you to, the last question, just jump in here. Your views on the respondents. I see something like 76% of respondents say that they don't do the fit test before being issued with a respirator. What is your view of that?
Gary, it's pretty much what I expected. You know, in South Africa, fit testing or face fit testing is not mandated, so it's not law. If you look at some of the first world countries, the UK, Germany, and even the US, before any user can use a respirator, they have to be fit tested. Now, there's a whole process. Fit testing would also require a medical evaluation to understand that you are fit to use a respirator. You can imagine someone with asthma, for instance, they might find it very difficult to breathe through a very tight-fitting respirator, such as a disposable respirator. And there are alternatives to that as well. When we come just to fit testing, and there was a question as well in the in the questions and answers, there are 2 fit test methods that are approved globally. One is qualitative and the other is quantitative. Now, qualitative is a very low-cost alternative. It really is a hood that fits over your head. There's a bitter or a sweet solution that we then spray into that. And it's a taste test, really. It's not a smell test. If you get a proper fit, you shouldn't be able to taste the sweet or the bitter. And again, there's a whole process. So I'm not going to go through that process as we have limited time. The other alternative is a lot more costly. It requires you to buy a system that could cost you anywhere from 250,000 Rand and up. But that is a quantitative. So that is a particle counter. There's no user input required. It is very, very accurate and very quick to administer as well. So those are the 2 test methods. And in South Africa, again, as I said, it's not mandated. However, we would like to see that happen. And for the simple fact that when people get that equipment, whether it's the best or maybe not the best equipment, if they don't know how to fit it and they haven't felt what it feels like to have it fitting correctly, you're going to end up with problems. You know, so from my personal view and also a 3M view is that fit testing should be part of your respiratory program that you implement on your site.
Some great insights there, Yaku, and I must commend our participants. At least they were brutally honest about whether they do or don't. So hopefully your feedback will assist them in making sure that they go out there and actually do that. Just a quick question: Can these filtering face piece respirators be reused? Can you reuse them?
It's a contentious issue. So if you look at the European standard and then you go specifically to the standard, the answer is no. You know, it's a single shift, single use product. However, we've seen in the healthcare environment that the nurses, doctors can't throw away those every time they see the next patient. So again, the World Health Organization have some recommendations on how to safely reuse those products. Some of the manufacturers have also been with the World Health Organization to talk about disinfecting. As 3M, we don't support that yet because the science doesn't tell us whether the product will be efficient after the decontamination process. So there's a lot of studies still going on, but again, follow what the World Health Organization is saying. They are the experts when it comes to that, but again, it's a contentious issue, and it's not a simple answer. It's not a simple yes or no.
Thanks for that, Jaco. Buffy, just from your perspective with eye protection, ear protection, hand protection, this issue of reuse, bearing in mind that in South Africa we have limited resources, things are tough, and just to get PPE sometimes is a challenge in its own right, let alone the best practice around reusing it. What's your view from your perspective?
Well, Gary, when it comes to the other PPE products, eyewear in particular, they can be washed, they can be reused, they can be sanitized. When it comes to a disposable product like a respirator, different story. As Jaco said, it is a contentious issue, and the answer is no. Do not reuse it. So yeah, with other PPE, to a certain degree, yes and no. But when it comes to respirators, I'm going to stand here by Jaco.
Thanks for those insights, Buffy. Psychologists tell us that, as human beings, we have a 45-minute attention span before we start disappearing. But before we bring our session to a close, I'd like to choose what could be a contentious question from one of our anonymous attendees today. And I'm going to pose it to you guys. I know we're talking matters respiratory protection, but so it does tie in. What is the major difference between the KN95 and the N95 masks? Which one of the two is the most effective in the COVID-19 situation? Perhaps I know a little bit about my panelists today, so I'm going to start with Ronnie. Do you want to share your insights, please?
Okay. All right. So the difference between it is actually just the differences in the different countries' respiratory approvals. So regulatory standards often dictate the physical or performance properties that a respirator or the product are required to have in order to obtain the certification or approval. So standards in different countries or regions may have slightly different requirements for certification or approval processes. So most regulatory standards for respirators are similar, but not identical. And the test method of the respiratory classes is where the difference comes in. So I know we've mentioned the N95 and the KN95. All that's telling you is that the N95 is an American regulatory standard. The N standing for non-oil resistant, and the 95 meaning it's 95% filtering efficiency. The KN95 is your product that comes out of China, so it is the Chinese regulation. And here again, it's also got the 95% filtering efficiencies. If you look at Europe, you would look at products that were conforming to FFP1, 2, or 3. In Japan, you would have standards that has the DS2 or the DL2. India has its own regulations where it's the BSI P2. Korea would just refer to it as a first-class respirator. And talking N95 being an American standard, there's also the R95 and the P95. And again, it's just basically what it has been tested and approved against. But all in all, these standards have been tested to very similar processes. There may be a slight difference in the methodology of the test or what was used in actual tests, whether it was sodium or whether it was an oil-based product. So if it has the legal approval, and here I do want to mention that we have seen product in the market which has been marked KN95, but it actually meets no standards whatsoever. As long as you've got the test reports and the documentation to support the products going through the testing, then basically all of these standards are the same. It's the filtering efficiencies that we are looking at. And of course, the fit testing will then determine how that fits on a person.
Thanks, Ronnie. Buffy, your view.
No, I totally agree with Ronnie. And, you know, when you mentioned it's contentious because we knew beforehand, and we had this discussing in the prelims to this on what is accepted in South Africa, and to make it, just to clarify, it is homologated by SABS under SANS 50149-2001. Okay, and that is an adoption of the EN standard, as Ronnie was saying. So yes, you know, as Ronnie was saying, familiarize yourself with the products, ask the questions, get the test reports. You know, just use your discretion and approach you know, reputable industry leaders on respiratory. Ask them the questions, look for the test results, make sure that you have that available, just so that you put yourself at ease, and your workers, or whoever you need to wear these things. That would be my advice.
Okay, thanks for that, those insights. I'm going to go just not around the table, but around the screen, and ask my panelists, please, just a few closing comments. The question and answers, we will get to those. I think some really nice questions there. Some of them technical in nature. We'll do our best and endeavour to answer those and submit those responses via the Creamer Media platform. But Jaco, just a few closing thoughts from you.
Yeah, Gary, thank you. So I quickly just want to touch on this N95 and then KN95. Just a reminder that in South Africa, and this is South Africa alone, respirators fall under compulsory standards. So the national regulator for compulsory specifications, there's an act, so it's by law that those products need to conform to specific standards. Technically, N95 is not allowed in South Africa because it doesn't conform to the European standard. However, because of the crisis and the shortage in face pieces, the national regulator is busy in the process of issuing licenses. All right, so I would encourage everyone online to chat to the NRCS, get involved with the SABS, let those guys tell you which products have been homologated or which of those have permits, and make sure that you stay on the legal side of it. And it's not just the legal side of it, it's also protecting the consumer. And that is my biggest concern in this whole pandemic. It's all about the end users and protecting people. So my last comment is my passion is respiratory protection. It has been for a long time. It probably will be for the rest of my life. Protect what you've got, but make sure it's done compliantly and legally. Thank you.
Brilliant, Jaco. Thanks for those insights. Buffy, a few closing thoughts from your side, please.
Yes, very challenging times. I've seen some questions coming through. Stock availability. This is a global pandemic, people. There are extreme challenges. And a guy asked me the other day, he said to me, what is the best mask to wear? You know, the best mask to wear is the one that you wear. You know, if you have access to a mask, wear it. But take the precautions, do the research, know what you are putting on your face, if it is going to help you, and just always be practical and bear these things in mind. There are very many unscrupulous people out there that will say one thing, but so take the precautions, do the homework, do the checks, and once you have the checks and balances in place, just wear the masks and avoid contact. That would be my recommendation.
Thanks, Buffy. Ronnie, your closing views?
Thank you, Gary. Before I give you my view, I just want to also just touch on the N95 a little bit more, because that seems to be the product that everybody in South Africa is looking for. People need to be aware that the N95, as I stated, is not the name of a product. It is the American regulatory standard to which it complies. That being said, there are two types of N95s. You get a surgical N95, which should only be used by the medical fraternity and basically in an operating theatre setting. And then you get the industrial N95s. Regardless of whether you're looking for the industrial or the medical N95, neither one of those products is legally allowed to be sold in South Africa. So I would caution you as to doing deals around those products without actually checking with your supplier or manufacturer if it's a valid product in this country. And that being said, you know, we are very passionate about what we do. Everybody on this team, everybody at SAPEMA, we've been fielding a lot of questions and answers from people, and we understand that people are now in an area that's unfamiliar territory to them. So please do reach out to us, reach out to the SAPEMA team. Even if you go online and pose a question there, we will gladly answer your questions. Because respiratory is not an easy subject to just chat in a 1-hour session. There's a lot of little intricacies that you need to understand and be aware of. And this entire team that you see here today and our extended team will be only too glad to assist with that. Thank you.
Ronnie, Carl, Buffy, Yaku, thank you for your insights. And in closing, I must say, I don't know a lot about PPE, but I know substantially more. And I'd really like to make an appeal after engaging with the panelists and sharing with you guys offline as well. For any of our participants that are not sure or unsure or want any insights, I can certainly say, even from a layman's perspective, the manner in which you've shared your passion for all matters, you know, PPE and actual hygiene and your care for what you do is indicative of the quality of the organizations that you represent as well. So on behalf of the Electromining Africa team, I'd like to thank everybody that made this webinar possible. Nothing like this can happen without behind the scenes work. I'd like to thank Raynette and the Creamer Media team, Shannon, all of your helpers behind the scenes, the SAPEMA team. You've enabled this entire conversation. The panelists and your teams back at the offices. You know, you're the face today of all of those efforts, but we know that there are a lot of dedicated souls behind your efforts and what you represent. And then, yes, a happy and a sad moment at the same time. Electromining Africa, what a wonderful event. You know, I've only shared in 2.5 decades of something that's been going on for 5 decades and will go long beyond my tenure here at Specialized Exhibitions. So to everybody, thank you for your inputs. Just a reminder to all of our participants that any questions that you have will be answered in one format or another. You'll be emailed. You can go onto the websites. Don't lose contact. Stay connected and enjoy the rest of what Electromining Africa Connect has to offer this week. Thank you, everybody. Travel safe, stay healthy. Take care. Bye-bye.
Goodbye, everybody.
Thank you and bye-bye.
Thank you, everyone, and goodbye.